morning, everybody. Thanks for coming in. I'm
Morning,
Apia.
Anita.
Morning. How are we all?
Good.
We're here.
Great.
Oh, well, I'm just glad that you're all here today. I'll do little checks before we get started. And I think the PowerPoint's good. So before I jump into this, I just wanted to touch up with a few things like work health and safety, just safety in the class and yourself. So our fire exits, as you get out the door, there's one on the right, one on the left. We're on the top floor. This building doesn't have a lift, so you always have to follow instructions from a fire warden. There's an assembly point as you step down the staircase, just on the right side, and same at the front as well. There's toilets, one on each side as well, and there is a drinking water dispenser just outside the class. Make sure you keep yourself hydrated, okay? Is there anything else that you should be mindful? Like if you need any help from me before we get started, just make sure you're comfortable as well. Is there anything that you need in particular?
No, we're pretty good, thanks.
Perfect. Your chair heights are fine. You can swap the chair if you wish to. But otherwise, just be mindful of the cords around you, just don't trip over, and try not to spill your drink bottles around the electrical. That's about it. I also wanted to make sure that, anything that you need in paper copy, can give it to you at the end of the session, so you can focus at this point, but definitely I'm happy to pass on the, hard copy. Okay, any questions? Pretty good. So today's topic is infection prevention and control, and particularly choosing the right precautions. So before I get started, I wanted to, know you all. Just starting. I know your names, but it's been a little while since I met you in this class. So just tell me about it and what you've been up to in your nursing career.
My name's Kelly, and I'm a previous ICU background. We had isolation rooms up one end of ICU where we put any of our infective patients in. In that instance, we had to full gown, glove, mask to care for those, and they were negative pressure rooms.
Oh, that's great. So just a special segregated area. That's very good. Yeah. Hello.
Hi, Peter. So I'm midwifery background. So we have got a little bit of a different setup. We do have 2 isolation rooms on our postnatal ward. They're both negative pressure, but we also have individual rooms with separate bathrooms that we can use as isolation rooms. And we've got 6 birth suites that we can also use as single isolation rooms, each with their own bathroom. So while we've got 2 specific ones, we've got a couple that we can set up as.
Yeah.
And the same as Kelly, we have everything from just basic gloves to full top to toe PPE.
That's great. Yeah, it's good to have good resources in the hospital setting, isn't it?
It is,
Yes. Hello, Trina.
Hello. So my background is medical, and more recently I'm working in an area that has 9 all self-contained single rooms with their own bathrooms, and outside each of those rooms we have disposal for infectious control. We also have stands that contain gloves, masks, and appropriate PPE, because that tends to be the ward where we get all our infectious people. We also have hand sanitizer inside and outside the room, and each room has its own electronic BP machine and anything else that is required, such as your BGL machines.
Yeah, so separate equipment lot for
Yeah,
infection.
all allocated to, yeah.
That's great. Hello, Jackie.
Hello, how you going?
Good. How are you?
I'm good.
You're already taking some notes. That's great.
Yes.
Yes.
Yes, so I was finding out the background about all these people here.
Yeah.
Yeah. And theatre background, so yes, we have lots of different infection control principles within that environment.
Yeah, that's good. So the common theme here is that we've all been exposed to different, infection protocols, and obviously from different hospitals. So you all bring different, expertise in this situation. So a little bit about myself. I've been nursing into medical, surgical, I started off with that. And then I wanted a bit of a change, so I went into COVID vaccination program. And that gave me a good, headspace to think about where I want to go next. Then I went into, ED critical care branch and did my postgrad as well. So at the moment I'm working as a teacher at TAFE, and then also between ED and critical care in Albury. So that's my background. So this presentation is going to take about 30 to 40 minutes. If in case you have to go to the toilet, happy for you to leave, quietly. You don't have to take permission from me. Phone calls, please, refrain yourself unless it's an emergency. And that's about it. So infection prevention and control, choosing the right precautions. So the objectives for today is, to build a standardized, framework for picking the right precautions in case of any infection presentation that we see in the hospital. So these slides include the key topic areas, the basic principle of inpatient infection prevention and control, standard precaution, transmission-based precautions, and other strategies for infection prevention and control itself. So as we go ahead, I'm going to break it down. So we all know what the infection is, just a definition there. So infection is the invasion of the body by disease-causing agents or pathogens followed by their multiplication and the body's subsequent response to these agents. So we all know that, infections, they fall in different categories caused by different pathogens. We have bacterial infection, viral infection, we have fungal, parasitic, and prions. The mode of transmission for each of them differs in a little bit, in saying that some get, transmitted by just direct, indirect contact, whereas prion, you have to get in touch with the body fluids of the contaminated person. But in general, some sort of contact with the infected person, in different ways, either it be body fluids or, droplets that are flying in the air, or, contaminated food or water, they're the, carrying bodies that carry the infection, and that's how everybody gets infected, unfortunately. There's some examples as well. For a bacterial infection, you have cellulitis, meningitis, tuberculosis, and STI, sexually transmitted infections. You have viral infections. Again, such a common one. We've been through COVID ourselves, a big breakout of Ebola in Africa. So we all have heard, but we don't know how it caused. So Ebola, it was from the bite of the infected animal. That's how it spread it, and then mosquitoes as well carried some of the other infections. So that's how the virus is spread, apparently. And fungal, contaminated food and water, similar sexual contact, direct, indirect contact. When it says direct or indirect contact, is that getting in contact with the person itself, or indirect when somebody sneezes, so they will disperse this droplet of sputum and sits on the surface, and that surface, those droplets already has their organism in that, and you go and touch it, the person's not there, but that's your indirect contact. So that's how the infections get spread. Parasitic as well, you can get it from dog bites, mosquito bites, or tapeworms. You have contaminated food and water, organ transplant, somebody, you go through the cross-match and everything, but they cannot, identify somehow that they can carry parasites with the organ, and that's how you get it. And then prion is, again, you can only find out about this disease through the biopsy, unfortunately. So one of the worst one to, have precautions for. So here we are, just an overview. You will get a full information in your Moodle shell, so you don't have to stress about remembering everything. And we've been through this in the previous class as well, so you should have some idea about this. There we are. So how we talk about transmission-based precautions, why that is that, every organism, whether it be bacteria, virus, or anything else like fungi, the cell of their organism varies in the size. The picture is not very clear. I could not get any bigger, any right side picture, because as soon as I tried to expand it, it just,
Went fuzzy.
went fuzzy. But as you can see from here, this is much clearer. So you have your frog eggs, which is 1 millimeter, then your chromosome and your biological cell, that is 10 micrometer. But then you come down to adenovirus, which is a virus, it's 100 nanometer. So they go smaller and smaller, and you can just imagine you cannot see them with naked eyes, and that's why we need all these precautions on top of what we already do, like washing hands or wearing just a normal mask or something. We just have to be really careful of what right PPE to wear so that we don't become a super spreader, or at least protect ourselves and our family and other patients that we look after. So you can see from this picture, even though it's fuzzy, this is human hair, how thick that is, and about there is where coronavirus cell lives. So you can just see hair is already so thin, and the cell of the coronavirus is so much smaller, and that's why we need to be making sure that we wear the right PPE again. So another thing that I wanted to talk about, even though we catch all these infections, they come from community, right? We come across a infected person, we catch it because of a number of reasons, like the low immunity, you're going through treatment, old age, young kids, they have low immune system. But also once the patient comes to hospital, they acquire, hospital-acquired associated infection. So because they're already vulnerable because of the infection or low immune system, because of the disease process that they're going through, that risk of catching some more infections. So here we are, healthcare associated infections are infections that are acquired as a direct or indirect result of healthcare, and it can lead to additional complications for patients and their families, as well as longer hospital stays. Which means that, somebody coming with pneumonia, they've got, compromised respiratory system, and then some nurse looking after did not use the right PPE, and they brought in influenza or COVID to them. So now instead of getting treated for 3 days, they will have to stay at least for 10 days because they can't look after themselves and they're more sicker. So that just extends their stay in the hospital. Then we have HIs can occur in various settings such as hospital or community-based health service. Both patient and healthcare workers are at risk of HIs. All kinds of staff member work, people from different health background work in the hospital, new mums, or they're going through some treatment. We're all at risk of catching infection, so we need to protect ourselves as well as the patient and their families to avoid, spreading the infection. So the common infections here are Staphylococcus aureus bloodstream infection, and then surgical site infection. That comes on when you're not using the right precautions again to look after your surgical wounds, which is very common. Somebody comes in with normal appendectomy. If you don't look after the wounds very well, they're gonna get worse and have more complications, extended stay in the hospital. And Clostridium difficile, so C. diff in a short form. C. diff infection. It is something that will never go away, and people develop this from the resistance of the antibiotics that they receive, and the immune system just goes down, and they get this infection, and apparently you can never treat this. Recent studies says that you can transfer some healthy fecal matter into infected person, but we're not going to get there because they have.
We talked about this yesterday, Kelly.
Because they have healthy gut bacteria, so that gives them a chance to heal away from the C. diff, but it's not a very common treatment, so it's an unfortunate thing. So we don't want to give all this to our patient, hey. So here we are again, basic
No, not
principles of infection prevention and control. So basic principles of infection prevention and control focuses on minimizing the risk of spreading infection, isn't it? We want to prevent than to cure. And the key principles here are implementing correct isolation precautions, personal protective equipment, environmental cleaning, breaking the chain of infection, and hand hygiene. So there are a few different ways, and they should be implemented at all the times, okay?
I have a question for you.
Yeah.
What do you mean by breaking the chain of infection?
Breaking the chain of infection is like, you know, how we have different modes of transmission, as in direct contact, or so if you follow the right precautions, you break up the chain. For an example, you touch the contaminated person, right, with bare hands, or even with the gloves. You touch the person, same gloves, you go to the next person, and you deliver that, you know, bit of bacteria. So to break that chain of infection, you remove the gloves, wash your hands, start afresh, so that you've broken that little change that you're causing. Okay, does that make sense, Trina? Yeah. Very good. We are going to do, a few more sessions. So there's 3 sessions. So one will be on hand hygiene, and then we'll talk about the chain of infections. But good question, Kelly. And there'll be a 3rd session that we're going to do about how to put on the PPE the right way, and also taking it off, which is called donning and doffing. Okay. But so talking about the precautions today. So the role of infection prevention and control, again, aim to prevent the spread of infection. 2 types of precaution used for that is standard precautions and transmission-based precautions, which is airborne, droplet, and contact. So it's very important that we understand the difference between the 4. Yes?
Sorry, I don't know if you've gone through this with us previously or not, but what are our standard precautions again?
Yeah, so I was going to get through that.
Oh,
I don't
sorry,
think we've
I've been
been-
late.
But that's okay. Here we are. That's the next slide. There we are.
Look at that. Should have waited, sorry.
That's okay. But I'm just glad that you're all very curious about this session. So standard precautions, which are set standard that we follow at all the times, no matter the age group of the patient, no matter what they're presented with, does not change. We can add on more precautions, but we cannot take these away. So what
So
this
can I
includes-
ask about
Yes.
So this is the basic line of precaution and
Correct.
prevention?
Yes.
Thank you.
Very good. So it begins with performing the hand hygiene, using the right PPE if applicable, or whatever is applicable in the situation. Use respiratory hygiene and cough etiquette, which is, covering your mouth, which is a common etiquette that we have. Using aseptic technique. We've been through the aseptic technique. What do we mean by aseptic technique, Trina?
Oh, so that's where we are going to not touch anything that is sterile that we're going to use on someone.
Good on
So we're going to use a non-touch technique.
Good on you. Thank you. And then use and dispose of sharps safely. So we do not reuse the sharp, okay, in Australia. Clean and reprocess reusable patient equipment. Perform routine environmental cleaning. Handle and store waste safely. Handle and store linen safely. You know what? You do not have to remember all this. There's specific science design, as you can see at the bottom, and for you to refer back, it's on the Moodle shelves for you, okay? Now, you've got that in front of you. So you don't have to remember, but as soon as your patient arrives in the hospital, you put these signs up so that it reminds you, gives you a visual, reminder that you have to do this, what's applicable here. Or you can make a different session plan and say, you've been using this size of gloves, or, if somebody's on chemo precautions, you're using purple gloves or something like that. Or if they have a wound, you can just highlight there's a wound, aseptic technique. This is just a visual reminder. But standard precautions, as I say, for every patient that we look after. Okay? Is it clear, guys?
Yes.
Yes.
Basically, you're saying hand hygiene, gloves. What was else on that slide?
Gloves.
Cough etiquette.
Cough etiquette.
Yes. And if the patient, the patient may not necessarily have the wound all the time, so you may not even have to worry about, aseptic technique. But in case if you're giving IV, drugs, you will have to still keep the right point sterile, not touch it, not contaminate that, isn't it, Jackie?
Mm-hmm.
Yeah. So, clear? Any questions on this?
No.
Yeah. Okay, the first one is airborne precautions. So, airborne precautions are used to prevent the spread of infections transmitted through tiny particles that remain suspended in the air. Very self-explanatory. If somebody coughs, it creates an aerosol, right? With tiny droplets of the vapor of, the respiratory secretions. They hover around in the air. Somebody somebody walks past, they catch that, they breathe in that, and that's how they catch the infection. So if somebody has diseases like, tuberculosis or measles or chickenpox, we must use these precautions. Yes.
What happens if they use a nebulizer?
Well, a very good question. So they're going to breathe out, it's going to loosen the cough secretions, they're going to cough out more secretions. We cannot, we cannot ignore this in that situation again, because they're creating more aerosols. So we really need to, follow our airborne precautions in that situation. Even though they may not be diagnosed with one, but at the same time, if you'd rather be, cautious than to be be sorry for yourself that, okay, you didn't follow the right precautions, now you got extra infections. Okay, so good questions, Kelly. But these days, nebulizer are known to be old school method of treating patients. They more rely on MDIs, which delivers equal right amount of dose that used to happen. With nebulizer, again, there was a lot of loss of dose, like the medication they're rising, the patient not receiving the right dose of medication.
So they've got to use a spacer with that MDI?
Yes, so that they get the exact dose that we're trying to deliver. Only if they're following the right technique as well. With the intubated patients again, you blow it in the circuit, so you can use nebulizer because it's a closed circuit, but not for the normal patient who can breathe normally. Yeah. So going back to our airborne precautions, the difference here is that using the P2 or N95 mask. Okay. So every hospital has got a protocol that every staff member gets fitted with N95 mask. Okay, because everybody's face shape is different. The one that fits to Trina may not fit to me. So we need to identify the right mask for ourselves and go from there. Okay, you always should have, and each ward should stock, all different types of masks. So you should not have a problem there when you go for the replacement. Again, next thing is the negative pressure rooms. It's a standard thing. You all come across one, so you're all aware. I don't have to go through it. Patient masking, surgical mask. So also while we protect ourselves, but if the patient is going to cough and splatter, we also want to put the mask on them, so there is low chances that they create more aerosols.
Do they wear the N95 mask too? Then?
They can if they wish to, but a lot of patients, because they're already going through the illness, they don't feel 100%, and there's stigma in the communities that they can't breathe very well. Well, we all live in those masks, but if they wish to, I'll be more than happy to give one. But surgical masks are a bit looser, so they'll be more comfortable with that.
Do you think they prevent the spread of airdrops to other patients?
The surgical masks?
Yes.
I don't think so. Like airborne, we don't. For ourselves, if you're going to go look after a patient with airborne disease, they must be isolated, and for you to be going in that room and looking after the patient, N95 is what's going to protect you and everybody outside the room. So anybody that enters the room should be wearing this PPE, which is N95 mask, and then your gown and glove and everything, including your standard precautions. Does it make sense?
Yeah.
So
So
N95
if the person leaves their isolated room for whatever purpose, would we put a surgical mask or an N95 on them?
N95, yes. And also the fact that if there is no urgent reason for them to leave, they should not leave the room. Okay. X-ray, they can come to the patient. Only if there is like, CT or MRI, they can go. But usually they will have to put the N95 mask and be the last one on the list so that they can do big cleanup afterwards. Okay. So standard plus airborne precautions. Contact precautions are used to prevent the spread of infection transmitted through direct or indirect contact with an infected person or contaminated surfaces. You know how I said that somebody coughed, your sputum, splatter or aerosol settled on the surface. It could be anything like, hard surface, soft surface, your linen or steel or wood. It does survive. The bacteria does survive for a different number of hours. There's a big study on different material, how long they survive. I don't remember that on top of my head, but happy to look out for you if you want to see it. So the disease that's spread by contact precautions, contact mode is MRSA, C. diff, norovirus. Okay, so this one really has got bigger size of the bacteria, so not so much fun or like airborne. So you can refrain yourself from wearing N95 mask, but everything else remains the same, which is your gown, glove, hand hygiene, patient placement, which is isolation, dedicated equipment so that we don't cross-contaminate between the patients, environmental cleaning, it's a standard for everybody, and restricted patient movement. So we do not remove a patient from the isolation unless we really have to. Okay. Is this making sense, guys?
Yes.
Too much of talking, but it's all very informative, isn't it?
Yes.
Droplet precautions are used to prevent the spread of infection transmitted through large respiratory droplets that are expelled when an infected person coughs, sneezes, or talks. Okay. So I've been giving this example, but again, depending on what you're infected with, the microbes or the pathogens size will differ, and that's why different precautions. Even though they're all respiratory, tuberculosis is respiratory, influenza as well respiratory, but because of the size of the pathogen, different kind of precautions. Okay, so we have here influenza, which is meningococcal infection that is spread by droplet mode. And the precautions that we're going to take for these is surgical mask. You can already see the difference. Patient masking again, is always protect your patient and yourself, private room, restricted patient movement, and hand hygiene. Okay, so you can see how important the hand hygiene and using the right PPE is. Any questions so far? Very good, because I'm going to come up with a case scenario and you'll have to tell me what precautions to use. So, you can ask any questions if you want to at this point.
Bring it on.
Bring it on. You feel confident? We're happy
Let's have a
with.
go.
Yes. So droplet. What's the difference?
Surgical mask.
Surgical mask. Airborne.
N95.
Contact.
Surgical.
Surgical mask. And standard precautions. Do we need mask? No. Very good. I'm quite impressed, guys. And I've got the list of references if you need to refer back. Okay. So I've got it from Australian Commission on Safety and Quality in Healthcare. Okay. Okay, so we've got Mrs. Smith. She's a 79-year-old female admitted to your ward after a fall at nursing home. She's usually independent but is complaining of pain down her right side. Doesn't really say which side, like the whole right side or upper body, lower body. She has no fractures on x-ray, extensive bruising and grazes to her right side and is here for pain management. She has a history of hypertension, hysterectomy and hep C. You're planning to dress her braces. She's actively oozing through the existing dressings. What precautions would you use?
Standard.
standard precautions, isn't it? Because you're dealing with a non-infected patient. She doesn't have any symptoms of infection so far. She's had a fall, appears to be like a mechanical fall because she can tell you what happened. And we're protecting ourselves from the blood, you know. Very good, guys. Okay, a pediatric scenario here. Molly is a 9-month-old baby. She's admitted to the children ward with gastroenteritis. Do you know what gastroenteritis? Do you want me to explain to you? We all Yes.
We're all comfortable with gastro.
Yes, very good. We all had it ourselves. You're measuring her temperature and heart rate and blood pressure. You're planning to change her liquid like soiled nappy. What precautions would you?
I'm doing standard and contact.
I'm done contact.
That's
Yeah.
correct. Yes.
What about you, Jack? What do you think?
Oh, everything.
If you
Full
feel
hazmat
like
gear.
there's nothing like overdoing your PP. If you feel like you need an extra mask, you don't have to justify. It's
Have you
because
not been in one of those hazmat suits before?
yeah.
You die of heat exhaustion.
I know, but some nurses, they're very anal, like, you know, they've got little kids, they don't want to take anything home, so, and that's one of me as well. But good on you guys, right answer. Third scenario, Van is a 48-year-old man recently arrived from Vietnam. He's been diagnosed with pulmonary tuberculosis. You're measuring his temperature, heart rate, and blood
Oh,
pressure.
airborne.
Airborne straight up, isn't it?
Airborne.
What did you say then?
Airborne.
Is there any questions?
No,
No.
you've got TB. We
Yes.
don't really, and it's pulmonary, so
Yes.
it's really what the form
Because if you don't use the right precautions, you can be a super spreader. Right.
Jesus.
I was going, God. No one of those hospital healthcare acquired infections.
Yeah. All right. Just to summarize, we went through what the infection is, what are the different pathogens. Tell me one. The
Oh,
pathogens.
yeah, bacteria.
Bacteria.
No,
Second
I
one.
want the prion.
Yeah, prion.
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 Yes.
Yeah.
No, I don't want it, as in I want the
Parasitic.
Parasitic. Yes. What about you, Jackie?
What?
The different pathogens. So bacteria, parasitic, prion, viral, and there is one more.
I got you, girl.
Fungal. Very good. So there's the 5 different pathogens that we can blame them for all sorts of infection. And then we went through hospital-acquired infection as well. How people come in with illness, they catch more infection, different kind of infection.
C. diff.
Very common to hospital setting. That's correct.
Oh,
It's a
God,
very
I
common
know,
one.
so you do.
And then we went through different precautions. So which is the precaution that we use in all situations?
Standard.
And we went through transmission base, which is airborne airborne contact and droplet, right? I've gone through these different signs that we can put out of the door of the patient that reminds us visually that what we need to do, even for the visitors or any multidisciplinary team member that goes through the patient room, must follow. Does not matter if it's a CEO or a cleaner, everybody has to follow the same precautions, same standards, okay? If somebody's unsure, teach them what to do, okay? Because it's your job as a nurse to remind everybody and, prevent the spread of the infection. Any questions?
Yeah,
well, you
well done.
So before we, thank you guys, that's very kind of you. So next week, we're gonna do hand hygiene, okay? So just try to wear a 3-foot sleeve or something so that, you don't get yourself wet.
Can you send me a message?
I will send all the details, but while you're here face to face, I thought I'll just take a chance to remind you what we're doing next week. And the week after, we'll be doing PPE, which is a lot of fun, a hands-on practice as well. Okay, thank you.
Thanks, Peter.
Thank you.